Okay, so we have our patient here. He is not in a good mood. He's sleepy. We've had to start over and over, and it's just not good. Anyway, so we're just doing our neuro assessment. He has stated his name. We've done hand hygiene. He knows his current location. He knows that this is important to me, so he's going to try. Can you state the current year and the month, Mr. Oates?
July 2025.
All right, so we're going to look at his pupils real quick. We're going to see if we can prop the camera. We're having a hard time with the camera already. So I'm just going to shine the light in his eyes. We can see that they both retract. All right, so both are when he's looking straight ahead, they both retract equally. They're both reactive to light. So I want you just to take a look at my finger. I want you to keep your head steady as I move your eyes. Good job. No problem with that. His facial symmetry, can you smile for me? Oh, thank you for smiling. He's not a happy camper right now. All right, so can you lift your eyebrows for me? Good job. Maybe they can see that. How about puff out your cheeks? Okay, and we won't pause it this time because we paused it and we went through a whole video. And anyway, so let's see, what else do we need to do? Everything looks symmetrical to me. I'm going to place my hands on your shoulders, and I just want you to shrug upwards. Okay, good. What about this shoulder? Is it weak? Okay, good. Thank you. How about hearing? I'm just going to whisper something in your ear, and I want you to tell me if you hear it.
Jake. Constantly.
Okay, good. So his hearing seems to be perfect. I do think that he needs a little bit of, you may need to make sure that he's wearing hearing protection when he works outside. All right, so we're going to test his motor function and balance. I'm just going to ask that you squeeze both of my fingers. Ow! That hurt. So he has a great grip. Everything looks good there. I'm going to push my hands to you. I want you to push them away. Okay, good. Now I want you to pull them to me. Okay, so he has, bilaterally, he has good hand strength. I want you to take your hands, I want you to hold them out in front of you, palms up, and close your eyes. Okay, and you're going to leave them there for about 20 seconds. Okay, I don't see any pronation of the arms, and so you can relax. Okay, so now for the lower extremities, which is going to be a little more challenging to record. So he's going to just push my hands with his feet like he's pressing a gas pedal. So I'm going to put the camera so that you guys can see, and we're going to get here and not look at my dirty floor. All right, good. All right, good job, good job. So he has bilaterally, he has good lower extremity strength. Now pull, well, the pull is a little bit harder. The pull, he can't pull his feet towards his head, I know, but anyway, we're just gonna skip that one. All right, so now we're gonna move on to the gait and the balance. I just want you to walk normally. You don't have to walk very far. You can just walk over to the counter and back. Okay, good. Perfect. And again, his chief complaint was dizziness, but he has been having a little bit of a high blood pressure. And by the way, we took it right before, and it was like 146 or 140s over 90. So he's good in that area. So moving right along. All right, so now we're going to do the Romberg's test, where he stands with his feet together, arms at his side. He'll close his eyes, and we'll look for any swaying, okay? All right, can you stand for me? All right, and you're going to stand with your feet together. Let's see if you can see that. And your hands to your side, and you're just going to close your eyes We're gonna see if we see any swaying in the patient here. I do not see any swaying. So, all right, good job. I do not see that you passed your Romberg's test. I did not see any swaying or loss of balance. Now I'm gonna ask if you would just sit back down. We're gonna do a sensory test on your face. We're just gonna lightly touch different parts of your body and your face. And you're gonna tell me where I'm touching, okay? Just keep your eyes closed. All right.
Cheek, nose, ear, neck.
Good, 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 good. So he's able to feel all those things. Let's see. I don't have anything sharp. The assessment does say to use a dull or sharp object alternating between the sensations. Now we're just going to move along. I want you to touch your nose with your finger. So this is the finger to nose test. I want you to touch your nose and then the examiner's fingers. You can open your eyes. I want you just to touch your nose. I want you to touch my finger. Oh, perfect. Perfect. You did a great job. So we're going to do it more than once. All right. I want you to do it again. I'm going to move my finger this time. Good. One more time. Good. One more time. Good. All right, he did good. All right, so moving on along to coordination, I want you just to tap the palms of your hands on your knees. Okay, good. All right, so now flip your hands from your palms to the back of your hand on your leg. Okay, now flip them back over and tap. And back over. Okay, good job. So he's doing great. Even though he's sleepy and he's a little ill. So the last thing I'm going to do is I'm going to just check your reflexes. We'll just check in your well, he did have knee surgery last year. We'll check his knees, his Achilles reflex, and then we'll check his biceps and triceps. Let me go get my little hammer. I'll put this here. It's right over here. All right. Are you ready? Hopefully they can see. All right. So you're just going to relax, and I'm just going to do some light tapping, okay? I think you probably need to be up a little higher so your leg can swing. But they just need to see through the video, so. Okay. Didn't see a lot of reflex there, but I understand. Okay. So if you can see this. Alright, okay, and then the biceps and the triceps we did earlier. You let me do them again? Okay. I don't think they can see. I just can't hold the camera and do the both. It'll be fine. All right, so from my conclusion of your neuro assessment, I think that you're fine. I just think that your blood pressure has been a little elevated, so I think you just should need to watch that sodium and your fluid intake, of course, and just cut back on some of the pork that you told me that you're eating and things of that nature. And then if it's still bothering you in 3 to 4 weeks, I want you to come back and we're going to reassess, okay?
Sounds good.
Okay, sounds good. All right, thank you.